of this clip, which discusses an overactive thyroid gland, otherwise known as hyperthyroidism. An overactive thyroid gland is quite common. It can affect between 2 to 5% of all females at some time in their life. It generally affects 5 times more women than it affects men, and the usual age group is around 20 to 40 years of age. Nearly all the cases, and that is over 99% of cases of an overactive thyroid, are because of a problem with the thyroid gland and not with the pituitary gland. Now, for those of you who haven't seen the normal workings of the thyroid gland, I would suggest you have a look at the other video clip on an underactive thyroid gland, where we discuss where the thyroid gland is and how the normal functioning of the gland occurs, which will give you a bit more insight into thyroid-stimulating hormone, TSH, and also T3 and T4, which is produced by the thyroid gland. Let's move on to have a look at what actually happens when you have an overactive thyroid gland. There are many symptoms that can be caused by an overactive thyroid gland. Here are some of the more common features that can be seen with an overactive thyroid gland. What we have is increased appetite due to the hormone increasing the metabolism in the body. It can affect your heart by causing palpitations, irregular heartbeats as in atrial fibrillation, but it can also lead to heart failure and high blood pressure. Because of the increased metabolism, it can lead to weight loss, can cause the periods in women to become lighter, and generally in men and women cause muscle weakness, diarrhea, reduced libido, tremors, gynecomastia, which is more noticeable in males than in females, which is enlargement of the breast tissue. It can present with a lump in the thyroid gland itself, which is a goiter, and it can also cause irritability. These are more the common features that can present on an overactive thyroid gland, but as I say, there are many others which may be the presenting feature. So let's actually have a look at what happens with the gland when we have an overactive thyroid. Here we have a picture of the pituitary gland just underneath the brain. As mentioned in the previous video clip on hypothyroidism, or underactive thyroid gland, you can see that the pituitary gland here is producing the little blue hexagons, which are the thyroid-stimulating hormone. Now, these are the hormones that activate the thyroid gland into making the thyroxine, which is T3, T4. Now, as you can see, compared to the normal situation, here we have very few blue hexagons. And this is because, as we can see further down, the thyroid gland is overproducing the amount of T3 and T4, which is represented here by the red and yellow stars. Now, because there's so much red stars, so many red stars here, which is a free T3, the blood is taking all this back to the pituitary gland, informing the gland that there is too much thyroxine already in the bloodstream, and therefore the pituitary gland isn't producing any thyroid-stimulating hormone, which would be the normal feedback. Now, as mentioned at the beginning of this video clip, over 99% of problems with an overactive thyroid are down to the thyroid gland, which is represented here in yellow, and not actually down to the pituitary gland at the top. So, what can we do to treat this situation where we have too many thyroxines or too many red stars here being produced by the thyroid gland to ensure that the body does not end up suffering with all the symptoms that we've discussed recently? Let's move on to the next bit. When looking at the management of an overactive thyroid gland, there are 3 main ways that this can be done. Let's have a look further down at what we can do. Now, here we have a representation of the thyroid gland in yellow, and it shows the 3 different ways that the thyroid gland can be stopped from overproducing thyroxine. First, you will see on the left-hand side in red, we have carbimazole, which is a drug that can be taken via a tablet form, which stops enzymes within the thyroid gland from producing thyroxine. So that is one way that we can reduce the amount of thyroxine in the blood. The second underneath is radioactive iodine. Now that is taken orally again, and that is absorbed by the thyroid gland, and from within the gland, the radioactive product reduces the amount of thyroxine that's produced by destroying cells locally. And the third method is shown on the right-hand side at the top, which is thyroidectomy, or surgery, which results in removal of part of the thyroid gland itself. There's a number of reasons why radioactive iodine may be the preferred option over something like carbimazole, and these are where the patient prefers to take radioactive iodine rather than take a tablet regularly. They may have persistent side effects to tablets that they're taking, such as carbimazole. There may be poor compliance with drug therapy, or there may be episodes of reoccurring overactive thyroid even after treating it with carbimazole in the initial phases. So these are some of the reasons why radioactive iodine may be preferred over carbimazole. In terms of surgery, a large goiter or a lump within the thyroid gland, surgery would allow for that lump to be removed. Now, as you can see here, following medication, because the amount of thyroxine that is produced by the thyroid gland is reduced, shown here by a reduced number of red stars, this is then fed back via the bloodstream to the pituitary gland, which then allows for more production of the thyroid-stimulating hormone, shown here as blue hexagons. So by reducing the amount of thyroxine that is produced, either with oral medications such as carbimazole, using radioactive iodine, or even moving further to surgery, it allows the thyroid gland to start regulating the amount of thyroxine it produces into the bloodstream, which then starts to regulate the whole cycle in which the hormone is produced. I hope this has provided some insight. If you have any further questions, you can always have a word with your GP or your local pharmacist, who may be able to provide further information. Now you should have clarity with what is normal, underactive and overactive, and how you can control your own bodily function. Have a look in my story folder and see if there are any patients who have shared their stories of living with a malfunctioning thyroid gland and how they manage.